We'd like to say welcome again to another in the series of our Zoom meetings, hosted by my schoolmates Vernette, Franklyn, and I. I won't be saying much because I can't say much today or do much today. The only thing I want to say is that whoever comes on, as usual, we would like to keep everything respectful, no condescending, disrespectful comments or remarks, and just keep an open mind for everything, whether pro or anti-vaccine. Vernette, I'll pass it on to you, and then you're going to pass it on to Emma afterwards.
Okay. Like Farah said, welcome everyone. And a special welcome to our guests, Dr. Marsha Simon and Dr. Suean Fontenard. We are happy to have you all here today with us. These two young ladies are two young, promising ladies from St. Lucia who are doing great things. And we are curious to hear what your guys are up to. So, Simon, can you tell us a little about yourself?
Okay, so oh my god, sorry. So I was just okay. So I'll go back. So I'm Marsha Simon. I'm an assistant professor at the University of West Georgia, where I teach educational research. So basically, I teach my students how to conduct research in the field of education, all different fields. But whereas my focus is on education, as researchers, we're held to this. So a lot of us are held to the same standard across the board. So before we engage in any form of research, we have to we undergo rigorous ethical training. So the basic of any research, whether it's scientific or in the social sciences, because I'm in the social sciences, we have an ethical obligation to our participants. So I just want to highlight that when a vaccine is created, the people doing that, they have gone through rigorous ethical training, and that stems from the what happened in the Holocaust during the Nuremberg trials. All the world leaders came to the conclusion that no longer will research be conducted on human subjects without permission.
People are still joining.
So once that is in place, you have a board, different boards. So for example, we have an institutional review board, the IRB, which goes through a study before they approve it. And to pass an IRB, you have to, there's a rigorous consent form that you have to go through. You have to explain how you're going to protect your participants. That's very important. You have to prove to them that your participants will be protected at all costs. And also more recent in the US, I'm sure you've probably heard of the Tuskegee experiment where Black men were part of a syphilis study and they had no idea. So those things no longer happen. I'm not saying the possibility of it happening is not. There's a possibility of that, but we are really held to high standards. So all of us, so it could be the NIH or the CT. So these are the two main companies and we have to update our certificates every 2 years. So ethically, so in a vaccine, when researchers try to create a vaccine, they have to prove to the board, to the review board, that they will protect human lives at all costs. There is very little harm. You have to prove that the goal is always to harm participants as little. Well, we would like zero, but and I don't want to go too much into the research, but there's something we call the probability, which is 0.05, which is 5%. And it may even be like for something as a vaccine, the probability would be 0.01, which is even lower before these things get approved. So I just want you to keep that in mind. And so I'm going to introduce Suean. So stood out. Like she she was always a really brilliant student. She always stood out, and she doesn't like people to say, but she really is a brilliant individual, like very. So she's always been that person, and she's now a postdoctoral scholar at the University of Pennsylvania. And so she does that. So she will talk a little bit about herself, and she's just continuing her great work. And now I will let her take over and just say why she felt it was important to participate in the study and what the merits are. Okay.
Okay.
Okay, hi everyone. I'm Suean Fontenard, and like Marsha said, she taught me in Form 1 at Vieux-Fort Comprehensive Secondary School. I graduated in 2002, and I then moved on to A-level. Then I went to Grambling State University. I did my PhD at the University of Alabama in Birmingham, and now I work at the University of Pennsylvania as a postdoctoral researcher in the Cell and Developmental Biology Department. My PhD work focused on beta thalassemia, which I'm not sure if many of us in the Caribbean have much experience with, but it is a disease like sickle cell disease, and it's actually worse than sickle cell disease. But the treatment options that are being explored right now, like gene therapies that are being designed for sickle cell disease, actually can be used for beta thalassemia, since they actually affect the same genes. They're both beta globin gene defects. So there is a lot of research going on in sickle cell disease here in the US, since a significant population of the African American population does suffer from it. And my research focused on trying to find genetic ways of curing the disease with gene therapy. One of the things that I've also done since I've been here is participated in clinical trials. This is, I think, my third one. I did 2 when I was in grad school. And when the opportunity arose for me to participate in this one, I volunteered because I know that one of the things that researchers have a problem with is recruiting Black and African American people to join these research trials because of the history of racism associated with clinical trials and just medicine in general. There is a lot of racism in medicine. There are studies done today on medical students, on medical residents, on doctors, wherein they say that Black people have higher pain tolerance than their white counterparts, and they give them less medication. When people go in with pain crisis for like sickle cell, a lot of the doctors don't treat them appropriately because they think that they're just trying to get drugs because they're drug addicts. So there's a lot of medical racism here in the US, and it's something that we probably don't deal with in St. Lucia because of in the study. And a side effect of that is that now that this vaccine is coming out, there is a lot of skepticism in our community, even without the racism in St. Lucia. There is skepticism about the vaccine, about how fast the vaccine was made, about the rollout of the vaccine and who's going to get it first, who's going to get it second, what's in it, will it hurt us, will there be microchips? And I'm sure you guys have heard all of the conspiracies associated with the vaccine that continue to be perpetuated by people who have absolutely no idea what they're talking about, but we can't really just brush them off because they are reaching audiences and they are influencing our friends and our family. And so I thought that doing this Q&A, I guess I'll call it, with you guys was important, so that when I give you the information, then you can go out into your communities and talk to your friends and your family and tell them what you know and give them the links to the information so that they can actually go in and find it for themselves, to find reliable sources of information so that they can then make informed decisions on whether or not they want the vaccine. So does anyone have any questions? How are we going to do this?
Vernette?
You're muted, ma'am.
Yeah, you're muted for that.
Yeah, I was asking, was there any preparation done prior to taking the vaccine, prior to being part of this vaccine trial?
No, not really. So actually it was happenstance, I guess, that I found out that they were doing the trial here, because I mean, last year when the virus was widespread, we here at Penn, we actually shut down pretty much completely. All research was stopped and everything. I was actually one of the few people who volunteered to go in like once or twice a week because I work with animals. My lab works with animals, so we had to keep the animals alive, keep them fed, ensure that everything was going on. So I volunteered to be one of the people who went in to take care of them. And when we opened back up, I met someone at an elevator, as luck would have it. And he told me that he was a participant in the trial and whether I'd be interested, because at that point, they didn't have as many Black/African American participants in the study. And so he gave me the number or the email address of the person who's running the trial and told me to contact her. So I did. So I emailed her and told her that I heard that the vaccine trial was being run out of pen, and she sent me a consent form to go over. So this is like how many pages? 21-page consent form. So these things are very detailed.
Right.
And there you have to read through it and ensure that you understand any comorbidities, that you don't have diabetes, high blood pressure, and all of the things that could complicate the results that they get from the trial. So they go through this consent form with you page by page to ensure that you understand all of the things that you're signing up for. And then you sign the form and they sign it with you. And then I got the vaccine on the same day, but sometimes you have to come back another day because there might be things that you need to do that they might screen you for depending on the study that you're signing up for.
Okay.
Vibrant, unmute yourself.
Okay, so I have a question.
Go ahead.
Hi, Suean. Hello, everyone.
Hello.
I was having some technical difficulties before. I heard you all were calling me to say hello and greet, but I couldn't do it early on because my system is a bit slow and my bandwidth is also a bit behind. So nice to see you, Suean. That's my niece. I'm assuming she's surprised to see so many family members, but Auntie Henrietta called me earlier on and she asked me to join. And I'm glad I can. So congratulations, Suean, on all your achievements and for participating in the vaccine. But what I wanted to ask you is, in the vaccine trial, how different is the trial to the actual vaccine, giving the vaccine now? Because sometimes I'm hearing, oh, the trial doesn't mean you actually took the vaccine. So can you shed some light on that? What's the difference between doing being in the trial and taking the vaccine now?
That's a great question. So when you join a vaccine trial, they need to have some people who took the vaccine and some people who get a placebo, which is basically saline solution. And the person giving you the vaccine and you do not know which one you're getting. So that is to ensure that it's blinded and that any side effects that might happen from the vaccine or placebo aren't confounded, so that they'll know the people who got the placebo. That's why we have that 96% effectiveness rate that you hear about, because half of the people got the placebo and a significant number of them got sick. And in the group that got the vaccine, very few of them got sick. I think it was like 10 people and then 96 people in the placebo group got sick. So that's how they do the calculation on the effectiveness. So I went into the trial in October.
Right.
So I went in for 2 visits, 4 weeks apart. I got my first shot mid-October. I got my second shot mid-November, but I didn't know which one I got. In the consent form, it tells you all of the side effects that could happen if you get the vaccine. So I had a strong idea that I did not get the vaccine when I went in because I didn't have any of the side effects. I didn't have a fever. I didn't have any soreness. I didn't have any fatigue. I didn't have any of that stuff. Right. But they do give you a thermometer so you can check your temperature in case you have a fever.
Right.
Like throughout the time of the trial, you get daily, you have in case, and they also have care for you if you do get COVID outside of the trial, then you can call them and have the doctor come to your house to take care of you. So there are really all of the things in place to ensure that when you're in the trial, you get the best possible care.
Right.
So then I got my second vaccine in November and I had no side effects at all. But
Right.
then they called 2 weeks ago to ask me whether I wanted to be unblinded. So as a vaccine participant, I got to jump the line. Since I was in the trial, I got to jump the line to determine whether I was in the vaccine group or the placebo group. And then if I wanted to, and I found out I was in the placebo group, then I could actually get the vaccine and stay in the trial so that they could study me as part of the trial to see how long the antibodies would last.
Right.
If I did get COVID, how would my body respond? And 2 weeks ago, I found out I got the placebo. So then I opted to get the vaccine. So I got the vaccine on that day. And then I had the muscle ache, but it's similar to what you get if you ever had a flu vaccine. Here in the US, flu vaccines are things you get every winter to help with combat with the flu pandemic. So it was basically similar muscle ache to what you get with the flu vaccine. So it was a couple of days soreness, but nothing huge. But I have heard from several people who did get the vaccine that the second shot is the one where your body actually ramps up and you get tired, you get a fever. So I was told not to plan anything for the day after the vaccine because I may not be able to do anything.
Okay.
So now that the vaccine is being rolled out, individuals are being signed up. It's a mess basically here. I'm not gonna lie. The government has made a mess of the rollout, but the states are doing their best. So they have different phases that they're trying to do the rollouts where people a certain age group, like over 75, I think was in the first group. Nurses, doctors, frontline healthcare workers got it as well. Now they're doing 65 and older. And as they get more vaccines, they're going to include more younger and younger, although I'm not sure that kids will ever be included because children were not part of the trial.
Yeah, I was about to ask.
So you had to be 18 and over to be part of the trial, I think, and children were not allowed to be in the trial. So I'm not sure whether children will be allowed to get the vaccine unless they do trials, including children with these vaccines. Since also they're not as affected as adults.
So I have another question, if I may, ahead of the rest of the group. Because there's so much skepticism, I mean, you mentioned it about the vaccine, and you know, obviously among a lot of different sections of community, you can imagine how badly it is here in the Caribbean. Yeah. Where we
I've been getting the group.
Yeah, we tend to always the virus, and it would contain things that would contaminate our bodies and make us into machines. And there's so much stuff I have heard about it. And I can tell you that it has its constituents that's following it and believing it. So there's a big, big bad campaign that's going on around the world. And what would you say to people who have that type of skepticism? And you know, what would you say to promote the vaccine? Some people who obviously know nothing about medicine, sometimes they're the ones saying the worst things about the vaccine. And then they send it to people who are promoting it. So there's a famous sentence that's said by many people. I didn't study medicine, so obviously that's not something I would say. But people say, oh, but I would never take it because the vaccines are things that are tried for a long time before we know if it's good. I say, well, that's okay. What's strange about that? That it has to go on and on. Why are all of you all repeating that same thing? So what would you say to the skeptics, and how would you say something nice about it? So at least we can.
So the first thing is that I would ask them to ask the people who are giving all this information, where are they getting their information? Because usually they can't really point out to a specific source. It's like they got a YouTube video in their WhatsApp group, they look at it, they listen to it, and then they run with it. So number one, I would say to listen to the medical professionals. Find good resources. Don't find resources that you can trust. Don't just trust the guy down the street who is selling his coconuts and telling you that the vaccine is bad for you, because he doesn't have medical experience and I wouldn't trust his judgment. Number two is that most vaccines take a really long time to develop because the diseases that they're studying are pretty new, and our technology great. That's the biggest thing that we have working for us. That technology has improved in leaps and bounds over the last 50 years. So like the shortest amount of time that it's taken to develop a vaccine before this one, I think was 5 years, and that was like the 50s. So you can't really compare what happened in 1950 to what's happening now, because the technology is so much better. Number two is that the coronavirus vaccine, though it was developed pretty quickly for this specific one, is not a new vaccine. mRNA vaccines, which is the one being used in the Pfizer vaccine and the Moderna vaccine, have been in development for years. The first time I heard about an mRNA vaccine was like my first year of grad school in 2010, that they were trying to develop one. They're still working on trying to develop one for HIV, which is much different from this one. But we've had coronaviruses before. Like I'm sure, I don't know if you remember in the news one time, there was the SARS.
SARS, yeah. Swine flu.
So those are viruses that are similar to this virus. So there have been people working on these viruses for years, like it's their life's work. So we've had the technology, and all we needed was the specific sequence of this particular vaccine so that they could basically put it into a machine, and that machine would just generate the mRNA that was needed for the trials. And these trials went from mice to monkeys and then to people. So these aren't just vaccines that they're just churning out and putting into people. There's rigorous research that has been done on these vaccines before they ever get into a human being.
Why you had a question, right?
Yeah, I think pretty much it's been answered.
Mm.
Yeah, especially with the time they took to develop
Henry, do you have a
it.
question?
Yeah. On mute.
I have questions.
Henry, hold on, Renata, going on.
Okay.
Mute when but so you can keep quiet.
Mute me? I come in for you just now, don't worry.
Mhm.
So some people seem to have their own explanation as to what the mRNA means. Can you explain it to Clay so people can stop using that as to explain to people why they shouldn't take the vaccine because it changes your DNA, because whatever mRNA means is blah, blah, blah. Please, thank you.
Okay, so it's understandable for people who don't have a very strong background in biology, because all these acronyms are just floating out there and they don't know what they mean. You know what you know you have DNA and you know you have proteins, but the mRNA is what's between those two things. That is like the translator between your DNA and your protein. So the mRNA is the effector. So we all have mRNA. It's what makes us work. So you have your DNA that's in your cells. The DNA has to be transcribed into mRNA before it can make a protein. So you have enzymes that turn DNA into mRNA, and then another enzyme that turns mRNA into proteins. So the mRNA is the intermediate between your DNA and your proteins, and it's absolutely necessary for your functioning. In every cell, 70% of the products in the cell are mRNA because they're being constantly generated. You need mRNA for every single process. No protein is made without mRNA. And then in addition to that, there are mRNAs that are functional on their own. So they prevent certain things from happening by binding to parts of your DNA and blocking proteins from binding. There are mRNAs that act as enzymes. There's all different kinds of them. There's technology that uses RNA to cut DNA to bring a protein in and cut the DNA for gene therapy purposes. But mRNA that is not as widely touted because it's like the secondary cousin that you don't really talk about, but they are absolutely integral to the survival of every cell in your body. And so it's not something foreign, except that the SARS-CoV vaccine, it's a foreign virus. The other thing is that since you don't have to go from DNA to RNA, it cuts a step in the process. Most vaccines are DNA vaccines, whereby you put in the DNA has to get transcribed and then translated. Since you're putting in the RNA, you're cutting out that first step, so you go straight to the protein, so it cuts out the amount of time needed for you to make the protein that will fight the disease. So that's basically what it is. And it's probably cheaper because you don't have to put in a whole DNA molecule, and DNA molecules need much more regulation than mRNA molecules would need when they get into the cell. Because making a DNA vaccine is a whole other process. You need the DNA to be stabilized, you need certain promoters, you need a ton of regulatory elements in addition to the DNA, whereas with the RNA, all you need is RNA with a promoter and the sequences and gets translated. So mRNA is natural. You have a ton of it in your body. It makes every single protein in your body is made from mRNA.
Got it. Wayne, you had a question?
I'm on mute now?
No,
on mute?
We can hear you.
Okay. Yes. First of all, let me say I long lost cousins of mine, my relatives, Dr. Fontenard and Dr. Simon. People probably wondering why I say they relate to me, but we went to the same school. We related. Understand? Anyway,
Yeah,
congratulations.
Where is Wayne from?
Where is from?
That's good. I'm learning something new now.
Reunion.
Okay.
Every day you learn something new, boy.
You had no questions. Just mute yourself. Okay. Congratulations to the two young, members of our alma mater, Vieux-Fort Secondary School. I'm very proud, very, very proud of your achievements. The first question I have is, in terms of, and basically both our specialists today will help guide me. We have medicine on the one hand, where the vaccine is concerned, and we have the reluctance of people to accept the scientific achievement. What do we do? How do we deal with that deficiency? Because there's so much skepticism right now with regards to the vaccine. And I notice it's creeping into St. Lucia, where persons just get a post something on YouTube and they just accept it and they believe it. How do we overcome as a because right now, I was not a skeptic, but right now I'm getting more confidence in terms of the vaccine. But we need some mass agenda to really educate people to accepting the vaccine. So both to the medical specialists and the education specialists, how do we bridge that gap? How do we allow St-lucians, especially, I'm talking about St-lucians, accept the vaccine as something that is beneficial and not detrimental? Because I notice there is illiteracy and there's also some medicine involved.
Marsha, you want to start?
You have to unmute.
You can go ahead, Sue.
Okay. So like you were saying, it's a lot of anti-intellectualism is what we call it here. And also it is bad actors. So I don't know where they're coming from. I don't know why they exist, but there are people who are just hell-bent on pushing misinformation for no reason other than doing it. Like they don't get anything from it. They just feel the need to do it. So what I think we need is education. And I think in St. Lucia, our population, we have benefited significantly from vaccines in general, for number one. Because the vaccines, we vaccinate our kids when they're young. We give them the MMR vaccine, we give them, I'm not sure if we give chickenpox right now, but chickenpox vaccine is something that's available as well. We get, how many vaccines do you give your kids when they're born? Like several different rounds. And we get boosters, we have polio, smallpox.
Polio,
like,
yes.
All of these vaccines, and those are things that have helped push humanity forward. If we didn't have these vaccines, we probably would be, our population would be a lot smaller, which probably would be better for the earth. But in general, those vaccines have brought us to where we are. Like these are the things that allow human beings to live as long as we have. You have people living 80, 70. Our life expectancy has increased significantly because we have these vaccines, because those viruses, they were there long before us. So we're lucky that we have developed as a species to develop the technology that can allow us to fight these things off, and we can get lifetime immunity by vaccinating a child when the child is 6 or 7 months old. So these are the things that you have to start with, like start from a place that they understand. You ask them, were you vaccinated as a child? Have you ever had smallpox? Do you know what smallpox looks like? Polio, things like that, that we have no concept of what they look like because we've never had to deal with them. And if they were to come back, it would decimate our society. So that's one place to start. And I think that the government has been botching the response to the coronavirus. I'm sorry, I'm gonna say it. They've been botching it. But I do think that an education campaign where they could have PSAs on the television where they can explain the different steps. So you don't have to put it all together. That people can understand. Recruit students, recruit the artists. We have so many people who are able to contribute in different ways. You recruit people from the Ministry of Health to give the information to someone who can put a great cartoon together and do something that people would be receptive to. Information is what we need. Because when you have an information gap, it leaves it open for something else to fill it up, and that thing filling it up is anti-science information, anti-intellectualism, and YouTube videos from people who have zero medical training and zero concept of what they're talking about. So I think that is what we need, education.
Emma, you want to elaborate?
Yeah, I just wanted to say, and for me, that's where the problem, because for us, we always have to prove. Like, I don't make a statement without validity. So that's a lot of the claims we have at home are not valid. A lot of hearsay, because people will say, "Oh, I'm not taking the," and I'll ask why, because I know someone whose mom took the vaccine and she died. It's never I read, and I feel like we have it at our fingertips. Google is right there at our fingertips, and yet we are so misinformed in 2021. So I think the education campaign is important. We need to show how it's not just, and I think I saw something at the beginning of the coronavirus. I think it was from Ted Acid. He did a wonderful, it was a cartoon. It was, if we have things like that, and I remember as a child when they had that anti-litter campaign, I can never litter. I can never litter. The government or whoever was responsible did such a phenomenal job of instilling that in my young brain, and I don't think I'm the only one responsible.
The Solid Waste Authority, yes.
I remember I have a friend who will do banana peels because she says it's biodegradable. I cannot even do that. So these are the things we need to do. Use the resources we have, and I don't know why, but that's what.
Yeah. Similar to what we have with dengue fever. Like, you have these campaigns every rainy season to throw out the water and ensure that the tires, like, these are things that I haven't had to deal with for the last 16, 17 years, but they are ingrained in my memory that you have to ensure that the tires you plug holes in your tires if they're outside in front of your house. You ensure
have to cover the drum.
Down. Like, all of those things, they stick with you. So they just need really great PSA, public service announcements, and good campaigns so that we could get our population ahead of it, because the vaccine isn't in St. Lucia yet.
Yeah.
So if you can get the information out there and prepare the population, then when it comes in, people will be lined up. You give them information on where to go, how to do it, and all those things. Like, we have an opportunity to get ahead of it so that we can do it right.
Ms. Strauss?
Yes. Remember, maybe you did, but I cannot remember what the sample size was.
So for this one, we had about 30,000 people. So 15,000 would have gotten the placebo and about 15,000 would have gotten the vaccine. So it was about 30,000 people with this one. And with Pfizer, I think they had 45,000 people enrolled.
Okay. Second question. Were you privy to the data? Like, when they did the study, after the study, were you privy to the results of everything?
No. So what the information that we get is what's available to everyone on the news. So the campaign, the vaccine maker, they have a website with information on demographics and like how they made the vaccine and so on. But the other information that we get, it's whatever is on the news. So you get the vaccine, they follow up with you about your symptoms and so on, but we don't really get any other information. I got a COVID test, like I got the nasopharyngeal swab when I went in, and they didn't even call to give the results if you're negative. They'll call you if you're positive, but they don't even call you to give you those results.
Because I was thinking whether they had any biases in the study and all of that, because all these things, a lot of people who are quoted, educated, and they would try and give you information, they would go based on these things. And if they're not happy with the study, I don't know why, like you said, some people would just give out information that's not correct. And I don't know why they up to mischief. So some people would just tell you things that, that would just make the study look like it was not good because of the variables, because of the biases and everything else. So I was just asking, I just wanted to know whether you were privy to the results of the study.
No. So whatever you hear on the news is what we had, like on that Monday, I think it was November 16th, when the Moderna vaccine results came out that they had 96% efficiency. Like, that was the first day that I had heard the efficiency data on the study. And it was actually the day that I had my second vaccine appointment. So no, we don't get any information. But that's one of the reasons why studies like this are blinded, and that not even the person giving you the vaccine knows what you're getting, so that it won't compromise the integrity of the study. So you don't know what you're getting and they don't know what you're getting, but they have it such that they equally distribute the placebo and the vaccine, so that half of the people will get the vaccine and half will get the placebo, so that they can compare the results directly between the two groups.
I'd just like to add something. I don't know if anybody have heard about it, but yesterday it made news on international news that Montreal now has discovered a pre-existing pill that was available for gout. And they did a group of researchers found out at the Montreal Heart Institute that this pill can reduce the symptoms and the most adverse symptoms by 45 to 50%. I was wondering if you heard of that, or Emma, if you heard of it. It just made news yesterday, and they're trying to put it out there. They say it's a cheaper form of treatment, and they also say it's effective to as much as 50%. I'm sure my friends, Nataki and Donald, probably they've heard about it. I have two friends from Montreal.
I hadn't heard about it, but it would be something that I'd be willing to look into.
I'll forward the information.
50% efficiency isn't 96%, but it's better than 0%, and I'm sure it's better than actually getting COVID.
And they said once it can't work before you get COVID. That's the only thing. Once you get the COVID, then your doctor can prescribe it for you. It's available in all pharmacies all around. But
getting COVID is terrible in and of itself.
Exactly.
And we're not absolutely sure how, COVID affects people differently, which is why we would like to encourage people to take the vaccine so you don't have to deal with the effects of it. Because COVID is a disease that we don't necessarily understand fully, and that it affects people differently. Some people are asymptomatic and they don't even know that they had it. Some people get mildly ill, sick for a couple of days, and they go about their business. And then you have people who are sick for months and who lose their sense of taste, their sense of smell. They have fatigue, they have muscle ache, they can't, you have people who used to run marathons who can barely climb a flight of stairs. Wow. So it affects your body differently, and we cannot predict how it's going to affect you. So there are people who are big into herd immunity, and they're like, well, I'll just get the COVID and I'll be fine. But you cannot predict how it's going to affect you as an individual. It's great if it affects 10% of the population and they don't recover fully, but how do you know that you won't be in that 10%? Exactly. It kills 0.1%, but how do you know that you're not that 0.1% individual who will die from it? Mm-hmm. So these are the things that we have to think of, because nobody thinks that they're the one who's going to get sick and die from the disease because of the percentages that they see, but these percentages have people behind them. And there is no predictive model of who is going to get sick. You have 100-year-olds recovering, and you have 23-year-olds dying. So what's different between these two individuals? How do you reconcile that a 23-year-old is dying from this disease? They were healthy, they were an athlete. And you have a 100-year-old who's been through life and weathered the 1918 pandemic, and they still survive.
True. One more thing. I'm an open-minded skeptic. I'm Rastafari, I'm into natural, but I'm also very open-minded for everything, you know what I mean? Yeah. And this is why we decided to have this forum. What is the difference between the modern day vaccine as compared to the vaccine we receive when we were at infant school or primary school? Some people are saying there is some ingredient like mercury or whatever. I personally don't know. So I'm gonna ask you that, and can you elaborate on that for me, please?
As children, number one, they vaccinate against different diseases to start. Number two is that those vaccines are usually DNA vaccines that have a weakened form of the virus so that your body can mount a response to the weakened form of the virus, which will still help fight the virus if you ever get it. This vaccine is an mRNA, which is like a synthetic molecule that was made in a lab, but it's similar to the mRNA that you have in your cells. So those vaccines, they're weakened DNA vaccines, weakened DNA molecules that have to be transcribed into mRNA. So your cell, if you put the DNA vaccine, it needs to make mRNA out of that DNA and then make a protein. Whereas with this new vaccine, it's already an mRNA, so it just needs to make the protein. So it works faster than the DNA vaccine.
Anybody else have a question?
Yeah.
So what you said is that it's not the virus. You bypass the virus.
This is not the virus. This is not the virus. This is just an mRNA to one protein, the spike protein, which is on the surface of the virus. So when that mRNA makes the protein goes into the cells, the B cells that are going to be around for a really long time, and they will show that spike protein so that if you ever encounter it, your body will say, oh, this protein right here, that's the one to this virus. Let's ramp up production of these subpopulations of cells that have the protein on this that can fight this virus and then mount a response, which is why it takes about 5 days, maybe 3 to 5 days to mount an immune response. One of the things that's being, now that the vaccine is widely available or somewhat available, we are learning that we are being told that, number one, we don't know if getting the vaccine will keep you from spreading the virus if you catch it.
Mm-hmm.
So it's possible that you're vaccinated, you can fight it yourself, but it takes a while for your body to mount a response. So while you're mounting that response, you might be able to spread it to other people who have not been vaccinated. So getting vaccinated is not a free-for-all to say, okay, now I can go to the club, I can go see my mother, I can stop wearing masks. So despite being fully vaccinated, we still have to adhere to the protocols being put out there so that we can ensure that we can actually get rid of the virus.
Okay, so getting the vaccine doesn't mean that you cannot get it.
It just means you can fight it without getting sick.
Yeah. So what is it about that vaccine that makes it like one for all, one size fits all?
Most vaccines are one size fits all. It's just that we get all our vaccines as children, as babies, because they're tested because of the diseases. When you're young, your immune system isn't functioning, so you need the vaccine to ramp up and to give you lifetime immunity. There are other companies that are making DNA vaccines. Those are coming on down the pike. But basically in ourselves. So all of us can make the protein. Like we all have the same machinery in ourselves that enables us to make the vaccine protein and make us able to fight off the virus. Something that hasn't been as widely published is that not everyone has lasting immunity even after they have COVID. And we don't know how long the immunity even from the vaccine lasts, because we have people now who are being reinfected a second time with COVID because their immunity has waned. Their antibodies have been like petered out. And I've heard of someone being infected a third time. Because
they were able to fight it and fend it off.
Yes, but the fact that you're getting infected a third time, I think, is a behavioral issue. Not necessarily a virus issue. It tells me that you got sick, so you thought you were immune, so you weren't taking as many precautions as you should have been.
It's just bad habits, that's what it is. And then weak immune systems.
Right. So that's one of the things that we need to think about. Like even after you've been infected one time, you still need to maintain social distancing and wear your mask. You still need to be careful. You can't just go off and act like you're immune from the virus, because it can reinfect.
But in a sense, it gives you a level of confidence, isn't it? Knowing that your body is able to fight it.
Yes, but you never know, like what one thing, like you might have caught something else. It might have weakened another part. Like a lot of people who get the virus are getting myocarditis. It's weakening their heart muscles. So you don't know if the next time you get it, you might have been able to fight it off. But since your heart is compromised, the next time you get it might kill you.
So it means there is it means that we are just in this bubble of this health crisis, and we have to be careful for a long time, because there's no need, because you had a virus, that means now you can take risk. It means we are just in a vulnerable environment. So it means there's a long-term behavioral change that has to take place, and it has to be for a long time.
And
that's what
the other thing. And the other thing is that, I mean, we have different variants, arising. And we don't know if the vaccines that have been developed, how fast, is it going to keep up with the variants,
So we have data for the first two that have been widely talked about, the UK variant and I think it was a South Africa variant.
Brazil.
We had results coming out last week that showed that the vaccines that we currently have are able to fight off those variants. But what we need to understand is that the variant won't infect you if you're wearing your mask effectively. We're talking about those variants being able to spread more quickly, but if you're practicing all of and have been living it up in the clubs and going to the parties and doing all the stuff and not taking precautions. If you take the precautions, you will be protected.
I have a, can I go through now?
Yes, sorry.
The issue I have right now, there are persons who did not take certain vaccines when we were going to primary school and infant school, and they did not develop any of the so-called illnesses that we took the vaccines to protect us against. Is there a natural inbuilt protection against the vaccine that certain persons may carry that we don't know about, or that you probably know about, you can share? Or, and the second aspect of my question is, every year I know in the US the flu shot or flu vaccine is popular. And in St. Lucia we have the flu, and persons do not take flu shots and flu vaccines in St. Lucia. We use quote unquote traditional ways of fighting. Yes. Are there
honey and lime?
Are there, exactly. So are there acceptable, but not you, but not yet. We'll go to the comedy section in a while. Are there known traditional remedies? I'm not going to recommend it. I don't know because I'm not a scientist, but are there known traditional remedies that, floating around?
Okay, so the first part of your question is, why aren't people who weren't vaccinated getting sick? And that would be because of what's called herd immunity. Since so many people, let's say 95% of the population is vaccinated against a disease, and let's say 5% isn't vaccinated, the 95% who are vaccinated, if they get sick, they can fight it off, and maybe they don't get in contact with that 5% while they're sick, so that 5% will never get in contact with whatever disease it is. If they get in contact, they will definitely get sick. It's not that they are innately protected, it's that the rest of the people around them are pretty much a barrier of protection. So they're in the middle and everyone around them is protected, so the virus is on the outside. So it won't get to them because everyone around them is protected. So that's what herd immunity is. It's just that it won't work if everyone is getting sick. So they're not innately immune. They are just lucky that the diseases are not in our population. And the other thing is that the diseases we're getting vaccinated against are diseases that we've essentially eradicated from our population. So in order for you to get mumps, someone from outside of St. Lucia who was not vaccinated and who can get sick has to have come into St. Lucia with mumps, get in contact with someone who was not vaccinated, and then they would get sick. Of your question is about naturopathic remedies for the flu. I will not dispel the use of or utility of naturopathic medicines. Our ancestors were using them long before vaccines came around and it worked for them. So I will not say don't drink your Dite Kosol or don't drink your orange leaf tea. But exactly, those things, they might work. The reason why scientists say don't necessarily use them is because they haven't done the research. Like, we don't have research institutes in the Caribbean doing research on the natural products that we are using as a small population, but they do know that the flu vaccine works. So that's what we use. And the remedies you're talking about can be used after you get the flu. They don't keep you from getting the flu. It's after you get the flu, then you drink all the tea and all that stuff. The flu vaccine is to actually keep you from getting the flu in the first place. And the reason why we get it every year is the flu vaccine mutates quite a bit. And there are several strains around, and we never know which one is going to come out. So they have to vaccinate you against 3-4 different strains at once. And even then, you might catch one of the other strains floating around.
So with the COVID, the variant you have in South Africa, you have in Brazil, you have in the UK, the chances are the possibility that probably every year we may have to take a COVID vaccine.
So we don't know yet, but it's entirely possible that with the waning immunity that happens after a vaccine, we don't know how long our immunity lasts. So that's why me being in the study is important, because I'm in the study for 2 years. So they're going to sample me every 3 months to see whether I still have the antibody after a year, after 6 months, after 2 years, to see how much antibody I have left over, if I have any at all. And then it might be that, just like the flu vaccine, we may have to be taking a COVID vaccine every year if our immune response doesn't keep us protected for a long time. So it's something that we have to think about as well. But right now, we're just trying to get everyone vaccinated initially so we can get over this initial hump. And we'll cross that bridge when we get to it.
Petra, go ahead.
Okay. Just to answer Wayne, one of the questions he asked. Some people, they don't vaccinate their children. They depend on the herd immunity, like Doc said. However, we had an MMR scare sometime last year. And those same persons who did not give their children MMR, when they heard of the scare, everybody started coming to vaccinate their children. So they know very well that they should vaccinate the child. However, you can educate people and let them know that if any of those childhood diseases come about and it's
so true.
sick, but they themselves, they're surely to get sick and get the full impact of the disease.
Right, the intensity of the illness is reduced when you're vaccinated against it.
When you're vaccinated. And to answer your question about the flu, we do have the flu shot. It's the trivalent flu shot. We have it. So you can get it every year, Wayne.
Good.
Wait, no sketch.
You would what it is.
So you do have the flu shot, but is it advertised? Is it something that's ready available to the population? Because I don't think I've ever heard anyone back home saying that they've gotten a flu shot. Like,
put a shot in a drink for me. I'll take it. I'll take it.
We started it a few years ago, but we mostly give it to those persons with chronic conditions, like they're more likely to get sick, but we give it to anybody who asks.
Immune compromised and so on. Is it free or do they pay?
Yes, it's free.
Okay.
Persons with diabetes, hypertension, heart disease,
cancer patients.
Yes, we give it to them, but it's free and Wayne can have it.
When you want it.
With ice. On the rock.
Wait. It's cold, you know, when we give it, it's cold. It's usually from the fridge.
With the glass, some ice. I'll drink it.
When Ketra will be happy to give you a shot.
Anyway, let me ask you a question. Let me just say that session that we have in there, my confidence in the COVID vaccine is getting a boost. So I believe that a session of that nature, especially with an education specialist and someone who knows about COVID vaccine in St. Lucia, is critical, because the persons who are coming on the news to give us the information, they are politicians, they are policy specialists, they are radio announcers, they are police officers. They are not persons who you can answer the in-depth questions. So I am going to recommend, as the alma mater, have a connection with one of the national radio or television programs and dispense that information to the people, because the skepticism, it is there, and it's all, if the opposition says the COVID is good, those who support the opposition will support the COVID. If the government says it is bad, all those who support the government. If the PS comes out, the PS is an economist, and he works in the Ministry of Health. You know nothing about that. The police officer come and talk about COVID and everything. We need persons like Dr. Fontenard and Dr. Simon to come out as specialists in that area.
And this is why we're doing this. You know what I mean?
Identify with you. We don't have to listen to Dr. Fauci on CNN. We can say, this Dr. Fontenard, Dr. Simon, they are from us. They know us. And they will not come more than likely to give us false information. They'll give us correct information. So to boost that acceptance of the COVID vaccine and the information about COVID, I believe we need to expand this forum, because we have the expertise, and I don't know what we can do. Have a national 1 hour on television on NTN in St. Lucia to give the information. I believe it would be very beneficial. What I'm
going to do is, when I record it, I'm going to send it out to the various media houses. Maybe when you can assist me in that, and we can take it from there. You know what I mean?
Yeah, we also tried to get a few, I think maybe we did it a little too late, try to get a few health people on board but it did not work out.
I reached out to the Prime Minister's office. I don't care. I just call and call. I don't care. And there are times I've sent messages to the Prime Minister's Instagram. I get responses. You know what I mean? This one, for some reason, I got no responses. You know what I mean? And the CMO likewise. So I will still keep doing it. We're going to get it out there. Don't worry. We're going to get it out there.
You mean our CMO?
Yeah.
St-lucia CMO, yeah. You know her, Kat, personally?
Yeah.
Vibert know her well.
Yeah, Vibert, we know that. Vibert knows her well.
Maybe can make a connection after.
You all know a lot of things, eh?
Oh, Dr. Simon is saying something.
Beyond the two of us, we have other friends who could be part of this session. I don't think St-Lucians realize we have resources. We have people who are very resourceful, who are taking part in all those things overseas, who can make significant contributions. So we can actually have a panel because we know other people. I mean,
can be created.
Okay, we'll work on that then.
Great.
Sorry.
It's not just about the COVID education. It's about inspiring our young people right now also to probably look into different fields. You understand? Because I'm happy I met my family today from the Vieux-Fort Senior Secondary School.
Come
on, dude.
Hold on a second.
That's why I was asking this gentleman, where is he from? So I was trying to figure out if he was
from Reunion.
Please.
How can I become a member of that family, boy?
Hold on a second, guys. Nataki Roberts is a friend of mine, a social worker friend of mine in Montreal.
Hi, how are you?
I'm trying to say something. If I'm wrong about your title, you can correct me. But
no, you're correct. You're correct. I actually have a question. It's regarding, well, here in Montreal, there was a decision taken by or Quebec, I should say, there was a decision taken by the government to give the first dose to as many people as possible and not I don't know the studies on this, but they said that it would be 90% effective even with just the first dose. Do you know anything in terms of the studies? And it's the Pfizer vaccine.
Okay, so the Pfizer vaccine is similar to the Moderna one. They're both mRNA vaccines, so they have similar effectiveness. One of the things that has been said by Dr. Fauci and other professionals in the US is that since the trials that were performed were 2-dose trials, they don't recommend giving just 1 dose. Because I'm not sure about the 90%. I've heard that getting 1 dose is about 50% effective after 2 weeks, but then you get the booster shot after the 2 weeks after that. So we're not sure what 1 dose, the effectiveness of 1 dose, since the trials were for 2 doses, and it's not recommended that you do this, but I understand why they're doing it, because they're trying to get as many people vaccinated as possible, and they hope that within the 4 weeks later, they'll have the 2nd dose ready for the individual.
Okay.
And the UK is thinking of doing the same thing.
Sorry, the UK?
Yeah,
you
so
said?
they were the first ones who proposed the idea of doing 1 dose and getting it in as many people as possible, and then hoping that that 1 dose will either protect them for as long as it takes or protect them until the 2nd dose becomes available, since manufacture of the 2nd dose is now one of the limiting factors of getting the vaccine to people.
Okay.
But I thought what I understood, Suan, is that they were from Fauci the other night. It's not that they would give the 2-dose one as one, but that they were going to create one where that was okay as 1 dose. I didn't get a feeling that it was the same one they were going to do one. So I don't know about what
I think the one that Ms. Roberts is talking about is the same Pfizer one, and the UK was doing the same thing. But there are 1-dose vaccines on the horizon. So the Johnson & Johnson vaccine and the AstraZeneca vaccine are 1-dose DNA vaccines. So those are coming up for approval, well, under review by the FDA in the US and probably the WHO body who does the analysis of the vaccines to see whether they can put them up for emergency use authorization, similar to the Moderna and Pfizer one. So those would be 1-dose vaccines and would theoretically be better for countries, developing countries, and they might also have lower storage temperatures, which is a whole other issue that is being dealt with, whereas Moderna's vaccine can be stored at -20 degrees, which is the temperature of a normal household refrigerator. The Pfizer one has to be stored at -80 degrees, which is a specialized freezer that you can get, or nitrogen freezer. So what the US is doing right now is that they're giving Pfizer vaccines to people in hospitals, the communities where they don't have the storage capabilities. So the other vaccines might be able to be stored at 4 degrees, which is the temperature of a normal fridge. So if they can store it at that temperature, then they can give it to more people. And with being 1 dose, then you don't have to track people down to get their 2nd dose, which is a whole other complication that public health workers will have to contend with.
Okay. The first dose and the 2nd dose. If after you get the first dose, you don't get the 2nd dose within the time, the 2 weeks that you're supposed to get
4 weeks.
4 weeks. What happens is how effective?
It's about, we've heard that it's about 50% effective.
Yeah.
Which, I mean, I'd rather get my booster shot and be 90% effective than 50%.
Yeah, but if you don't get it with it,
that it's 50%, which is what the flu vaccine is. 50% is as a benchmark is pretty good, but we know that we can do better. So that's why we're pushing getting.
So the 2nd dose would bring it up to the 90 whatever percent?
Definitely. Yeah.
Okay.
Is there any significant difference from the Pfizer and Moderna? Because I have this nurse friend, and she said they were giving the vaccines, but because it was the Pfizer one, she turned it down. She said she would have preferred the Moderna, but I was in a rush and she was in a rush. I didn't get from her the reason why.
They're essentially the same backbone of the vaccine. They're both mRNAs that were designed at the NIH. In labs at the National Institutes of Health. It's just that we need partners in industry to do the ramp up of the manufacturing. The difference between the 2 vaccines is what they're in, actually. So the mRNAs are the same. They might have specific small modifications on them to help stabilize them, but the coating, what's their inside is what's different. So they have proprietary patents and all kinds of stuff to say, you know, this is better and this is better. But I know that the Moderna one is inside of what's called a micelle. So it's like a bubble with lipids on, like a small lipid nanomolecule. So you know, like you guys did biology, so you know that your cells are made of lipid bilayers. The Moderna vaccine is in a lipid monolayer. And I'm not absolutely sure what the Pfizer one is in, which makes it needing to be stored at -80. So that's the difference. So it's what they're in is what causes them to be needing to be stored at the 2 different temperatures. So what they put the vaccine in to help it get into your body and have it not be destroyed and attacked before it can be translated into protein.
To the 2 doctors again, I'm gonna be representing the skeptics. Even if I'm less and less skeptical now. I invited a few of them on to listen to, I believe in listening to both sides with open mind, you know what I mean? But none of them are here today.
I have a question here.
Yes, Ms. Charles?
I was listening to Dr. Fauci say that you should not take both vaccines, like the Moderna and the Pfizer. If you took Pfizer, your 2nd shot should be Pfizer.
Yes.
Unless in an emergency, you should not mix the 2.
Right. So that's because we don't exactly know how your body's going to respond to getting those 2 different coatings, basically, the things that coat the mRNA, since they're 2 different patented molecules. So that's why we try to keep everything consistent, because we don't have cross study results. We don't know how those 2 things, they might work just as well because the mRNA is exactly the same. But we don't know, and we don't want to give people information. And if somebody has a contraindication, they're allergic to something in one of the vaccines versus the other one, despite how small the changes are, then that can set the vaccination protocol, like the vaccination rollout back, because somebody say, well, I got the vaccine and I got sick, but they won't tell you that they went for one vaccine and then they went for the other one and mixed things up. So that's why we did the Moderna trial, 1 vaccine, 2 shots, Pfizer, 1 vaccine, 2 shots. In the future, once we get the pandemic under control, those other studies can be done to see how well it would work. If you get one and you travel and your 4 weeks are up, can you get the other one that's available wherever you went?
How optimistic are you, doctor? How optimistic are you? You said in the future once we get under control. You personally, how optimistic are you?
Am I optimistic? No.
Well, I mean, for the facts.
I'm not very optimistic because of people, basically. Because of how people are responding, how people are reacting, how anti-science and anti-intellectual.
Not because of the science, but
not because of the science. If we follow the science, would be great. I mean, just look at how they've had it under control in New Zealand and Australia, because they did what they needed to be done. They shut down the country, they took all the precautions, and now they're back to normal. Like they're back to they have cricket, they have football, they have rugby, they have parties, they have everything because they took the necessary precautions. Here in the US, you have people who don't want to wear a mask. Something as simple as wearing a mask has become a political issue, and people don't want to wear masks because they're saying it's the liberal agenda.
Simon was telling me that in Georgia,
the carbon dioxide will make them sick. It's blocking their natural flow of air that goes. And they won't be able to find them. I mean, the conspiracies that you're hearing just about mask wearing does not make me very confident that we're gonna get this thing under control. But we can have hope, right? we can hope for the best and expect the worst. In St-Lucia, it's different. In St-Lucia, I'm hoping that our population is way more educated, that it's an 80-20 split instead of a 50-50 split, so that we can get this thing under control, and that the cases are much lower back home. So like once you take care of the few people who are infected and you get rid of the vaccine, you get rid of the virus, then when you put a testing protocol in place for people coming into the country so that you don't let tourists go to hotels and then roam around within the population, and if they're sick, they spread it to individuals. Once those things are in place, I think St. Lucia has a much better chance of getting it under control than the US.
I had my doubts until I spoke to a Rastafari elder of mine called Mutabaroka, and he said, put it in perspective. Aspirin kills thousands every year. Many other medications out there have adverse side effects. So we just want to keep an open mind. He's not saying you should be for it or against it, but just keep that in mind, whoever wants to make that decision.
Like if you watch those ads on television, at the end, they'll tell you all of the side effects, which, I mean, if you want to take a drug for heart disease, but then your side effects are diarrhea and like rashes. Like when you read the list of the side effects, you're like, do I even want to take the drug? I might as well keep my illness instead of dealing with 10 side effects from this one drug for this one thing that I have. So every drug has side effects, every medical procedure that you undergo, every time you go in, that's why the doctors ensure that you understand it might be a 5% chance of mortality, but it's a chance.
Go ahead, Vi.
No, I was saying it's a matter of weighing the risk, does the benefit outweigh the risk?
Outweigh the risk, right.
Yeah.
Can I ask you a question, another out of the box question? Do you think it was manufactured?
No.
I have to ask all these questions.
I don't, because we've been studying coronaviruses for years. Like this isn't new. Coronavirus in humans is new, or this widespread is new. The other thing is like the other coronaviruses, their mortality rate was so high that when people caught them, they died. So it didn't get to spread as much as it's spreading right now. Like MERS, I think, has like a 20% mortality rate, whereas the number of people when they get it, they die right away. So we don't even it won't spread because it's killing the host, whereas this coronavirus, the mortality rate is low, but then the infection rate is high, and people getting sick and having long-term effects is what the problem is right now. But I don't think it was manufactured. We have these things like bats and animals, they carry all kinds of viruses. With Ebola, and I looked at the numbers and it was like less than 12,000 people died from Ebola throughout the course of the disease, and they made it such a huge deal. And now we're up to 410,000 people died in the US. And still we're like acting like the virus, some people think that the virus doesn't exist, or that they can get it, Open-minded
question again, the whole Bill Gates thing. I want to hear more about it. What do you personally think about
what
it?
Bill Gates thing? I try to stay away from conspiracy theories, so you might have to educate me.
But I just like to throw it out there and to hear what.
So what is the Bill Gates?
People are saying Bill Gates.
Farah is Fox News. Farah is Fox News.
I know what Fox News. I know Fox News. People are saying that Bill Gates out there. He's part of this whole conspiracy to manufacture I call it vaccines and microchips and all these things out there. I personally, I don't believe in that. I'm just telling you. I'm just throwing it out there.
Have you seen the needle that they put the vaccine
I know
in?
that's stupid. The whole microchip thing. I never.
Right. So I mean, if Bill Gates is contributing money to help with manufacturing the vaccine, and probably in like West African countries, I think his foundation is very entrenched in helping to treat malaria and AIDS in West Africa. So he might have some interest in some companies that are able to manufacture vaccines and so on. But I try to keep away from the conspiracy theories and not even bother watching them because they're just so far out there.
I just come to my own thing. Don't let anything sway me. I listen to both sides or whatever. I come to my own conclusions. You know what I mean?
The virus is from an animal. It jumped species. It mutated and jumped species. And we hadn't seen it before. Have any of you seen Contagion, the movie? Anybody?
Yes.
Yes, we have.
Yeah.
Yes.
So the movie Contagion is basically similar to what we have, what happened, where a bat put a piece of food and a pig ate the food, and then the pig was slaughtered in a restaurant. So then people who ate the pig got infected. And so then the virus got spread throughout the world.
Wow.
So it's not necessarily the exact same sequence of events, but we think that that's what happened, that it was a bat virus that got into some exotic species, and the Chinese medicine, their naturopathic medicines in China, they use that animal in those medicines and they sell them at the market. And it was able to get into some individuals who came into contact with it.
Are you pro vaccine passport?
For places like St. Lucia, yes, because we are small and we cannot handle having an outbreak that could destroy our country, destroy our economy, like the economy that the government is afraid of shutting down if unsure if immunity will keep coming, will stick around, then people will keep getting sick and we'll end up losing more of our people. So I do think that we need to put in measures in place to protect our population. If they don't want to do it, then stay home or go somewhere else.
True that. Mr. McFarland, you have a question?
Okay. Okay. Again, I'm speaking on the behalf of, let's say, a conspiracy theorist. I'm not a conspiracy theorist per se myself, but I am skeptical of lots of things. But regardless of that, this particular person is a strong conspiracy theorist. Like I get things in my inboxes like 10-minute lectures on conspiracy theories, which I don't even listen to most of the time. But when they do come and talk to me about these particular things, I don't necessarily have answers to these particular things. So I asked her to join this particular meeting because I wanted her to have a good idea from educated people about this particular thing, but she was not able to do it at the moment. Anyways, that being said, she was asking me what the long-term effects of this particular vaccine would be, and if it affects your autoimmune system in the long run of this, and if there's any validity to this particular thing, and what can I tell her?
Okay, so the vaccine is the mRNA that's being made. It's injected into your muscles, but then it eventually gets to your immune cells. So the immune cells in question, in this case being your B cells, those are the cells that make long-term immune cells. So you have B cells, you have T cells, you have there's a myriad of other immune cells in your system. So we're hoping that you do have long-term protection. It won't affect autoimmunity because autoimmunity means your body's fighting against itself. Like your cells are fighting against your own cells, which is what diseases like lupus are. When your body doesn't recognize itself, so it's fighting itself constantly, and you have to take drugs to suppress your immune system to keep you from essentially fighting yourself to death. So it doesn't, the SARS, the coronavirus, it's not self, like it's not part of you. So your body will not fight against your body because this is not part of your immunity. Like this is not natural to you. It will only attack when the coronavirus comes in contact with you. When you get infected, then it will fight it. So yes, we're hoping for long-term protection. We don't know if we're gonna get it, but it will not affect autoimmunity. Unless you have other underlying diseases that might cause some other problems, which is what the coronavirus is doing anyway. Getting the vaccine and getting the coronavirus are into different cells of your body, and it's going to have multi-organ system failure. Even your brain, now we're hearing that the virus incubates in the brain. So it's dormant in the brain sometimes and it can get reactivated. Like that's why people have brain fog. They can't remember different things. Like it's one of the long-term effects of the virus. Okay. So getting this one protein is different from getting every single protein in the virus. It's just the one protein that keeps the virus from entering your cells that you're able to recognize.
Wow. Anybody else has anything to say?
Any other questions?
But sorry, quick question. Is this recorded?
Yeah.
The discussion today?
I'm recording.
Okay, and are you able to forward it to us?
Yeah, I will. I'm going to YouTube also on our YouTube page and everything, you know, so.
Okay,
I can forward it to you personally when it's done.
Okay,
you know?
Thank you.
Dr. Simon, my niece, everybody, it's my niece.
Okay.
Dr. Fontenard, do you guys have any plans in the future to apply your expertise on the island? Is that any part of your plan in the future, or just
they say we make plans and God laughs, right? So I don't have any direct plans right now since I don't know what the future holds. Like this virus came out of nowhere and now it has driven us into a state of pandemonium. I would like to eventually teach. I'm not necessarily sure exactly what my expertise would be. We don't have any universities on island that I could actually do any research. But I do think that science and math education is really important, and it's something that is not necessarily taught the best way. So I do think we need curriculum overhaul on island and to help teach students in the best way possible.
We can tell you
that. Be open to teaching as something for the future.
Dr. Simon.
Yeah, definitely. So we have study abroad programs. So I am trying to work with the SPL, the speech language pathologists. So they do a study abroad in Belize. So I'm trying to see if I could get a grant with them to go to St-Lucia, because well, when I left, I don't know for now. I know when, because my brother's also, he's on the spectrum. So there was no speech therapist on island. So that's actually what I left to do, but I got derailed somehow. But yes, I'm definitely looking to have some grants, like some study abroad programs, like summer study abroad programs in St. Lucia. Definitely looking to work with them.
Well, I'll tell you something, and we're not going to make you guys hidden figures. Huh? It's not going to be another hidden figure, straight up, you know what I mean? Educated, intelligent Black women from St. Lucia, I mean, doing research and have so much to contribute, man. We're going to have, like Wayne said, we're going to do whatever we can to push it out there, you know?
You're freezing.
Montreal snow.
Anybody else has anything to add?
Well, I want my best behavior today. I mean, in the midst of royalty, so you know, that'll be very nice.
Yeah, and be honest to the ladies. Tell them where you're from.
Oh yeah, we could do a round table. Like tell them so we can get your name.
About yourself. Wayne, start with you.
Well, actually, you see what's in my thing there. I'm preparing to make some bakes, you know.
Yeah, we might be in for a long ride.
So, tell the lady where you're from.
Oh, bye, guys, a long ride. I'm from Vieux-Fort. Probably you know around, well, when you were in secondary school, around the Backada area, you know, around the area, at the back of True Value by the gas station.
Yes.
Real.
That's where I'm from. Yeah. So.
But he's done well for himself.
Tell the lady everything. Tell the lady you're a practicing attorney.
Yeah.
From Vieux-Fort.
My family know me, you know. What do you?
They don't know you. They phone you.
Yeah, well, I'm practicing. I'm practicing since 2001. I'm practicing law.
The last name?
Yeah. Harrow, Harrow.
Oh, so you're related to Janice?
Yes.
Okay.
Actually, we related, you know. I tell you.
We went to school together. I know Janice and his wife.
Yes, exactly. My cousin, Janice, yeah.
He's also a prolific calypso writer. Tell him that. We're proud of you for that too.
I will get to that stage, that chapter just now. Your Dr. Simon, I think it's your great grandfather. That's my neighbor, you know. The blacksmith, Godan, Papa Dan.
One of the two blacksmiths on the island of St-Lucia. My uncle and my father.
Yeah.
Is that
my
how
neighbor,
you're related?
Yeah, we related that way, yeah. Blacksmiths.
But,
yeah, so I'm happy. I'm very proud, man. I think we have to do that more often. Get our people, because we just say we come from Vieux-Fort senior sec, but we have a lot of specialists out there and people who have done well. We have to bring them in, bring the family closer together to utilize the expertise. I think that's a very good start. And we have, even in St-Lucia too, we have, our nurses on board, our doctors and everything, our educators. We have to bring them in and try to share the knowledge, because we cannot be too selfish if as you said, the intellectual bias or whatever. You have to be very honest and bold, because in St-Lucia right now, just teach people, they get educated, they go. We have to come back and make the link, a connection. And that's basically what I'm hearing right now. I'm so happy, because what I'm suggesting right now is that get that expertise out, so people in St. Lucia, I really care much about, I care about everybody else, but I'm being very ethnocentric, very biased towards us right now. Greater confidence in what's happening. So I'm extremely proud. I'm happy for those who were able to get you wherever you are, in your labs, in your study, in your library. So that's basically me, you know. So that's all.
We are extremely thankful for this platform.
Very.
Having those.
Thank you for having us.
Yeah, we're really grateful, because we wanted to reach out to the St-Lucian public, because we know, okay, Americans, they getting all the education about the vaccines and whatever, but we wanted to make sure that St-Lucians are, educated about it, so they would have an open mind when it gets to St. Lucia. So our intention is to put that on YouTube and have them take a listen to the discussion that we had.
And we had to make it a priority, because we have other guests coming in, but we had to make this one a priority.
We had to deal with that one.
We can get it out there in St. Lucia. Nurse Ketcher is going to be a future guest of ours. Just to let you all know, Wayne Harrow is going to be a future guest on law, you know what I mean? So we're going to we had Dr. Gila at the top, what's his name? The top.
Yeah, we did the mental.
Psychiatrist.
The psychiatrist.
We're going to keep moving.
I mean, even with coronavirus in the US, it's affecting people, but it's affecting Black people disproportionately because of all of the issues, systemic racism issues from the past, where you have poor health care to begin with. So now that this virus is here, you have people who have diseases, hypertension, diabetes. Those people are more at risk for the virus. And it's also something that we deal with back home. So it's something that needs to be talked about, like living a healthier lifestyle.
You're right. Yeah, that's why we specifically chose certain topics to deal with the current situation. Like we did the mental wellness. A lot of people are losing their jobs, and they have to be dealing with this kind of situation. And then we have our next topic is wellness, how to keep their bodies healthy and stuff like that. And we're going down the line with a few topics dealing specifically with the virus, the impact that it has on people, guidelines as to how to deal with certain things happening.
Definitely. Great initiative.
Good, yeah.
Thank you.
Very nice.
Hold on, somebody's coming.
Yeah.
Where's Henrietta? Henrietta asked me to unmute her. I said she wanted something. Henrietta, you can unmute yourself, Go ahead.
So funny.
About time, damn it.
What is that for you, ma'am?
Gonna fix his ass later.
Okay.
You mute yourself.
No, I didn't. He mute me.
Okay, go ahead. My apologies.
It's a good thing, man.
I forget.
Oh my God.
Oh yes, I know what I was saying. So they've been talking about people with underlying causes.
Conditions.
When they get COVID, 9 out of 10 times they don't come out of it. I don't know if any of you two can explain to me, but how somebody with heart failure, liver failure, kidney failure, on dialysis twice a day, diabetes, high blood pressure, cholesterol, prostate cancer, come back from COVID?
Do you know someone with all of those things who came back?
Yes.
See, that's the problem. Like, the disease is private. Like, what it does to an individual is private to that individual, and we don't understand. So that person will probably be under the microscope from the researchers trying to figure out how did they survive this disease with all of those comorbidities, is what they're called. How did they survive having all of these complications, but there are people who have no complications, no known complications, who die from it?
I know.
So I have
crazy.
no idea.
I keep going back and forth. I even said to myself, does dialysis have anything to do with that?
We have no idea. Like, that person will probably be studied. They'll probably be going in under the microscope to figure out exactly why they were able to fight it off. They might have had
for 2 days, he couldn't talk. He could barely breathe. It's like he was gasping for breath to get a word out. And a week later, he's like back to normal. I'm like, what?
Wow.
Yeah. So we don't know. Like, we don't know. So that's the problem. So someone like that, you would expect them to pass from it.
Exactly.
And they survive, and we don't know why.
I was hoping 2 days later to get a call. He's dead, but a week later he was back to normal.
I don't think you want to say hoping. You were expecting.
No, I was hoping.
Anyway, there you bad go. But in the beginning, they were saying that some diseases, not some illnesses, their treatments probably helped. Like, I heard lupus, they were treating them with that hydroxychloroquine.
The drug, we're not sure. Like, hydroxychloroquine, like, there was a run on it. The government bought up all the supplies. Right. We're not sure. Like, the sample size, I think, that they were using in Europe is different. And the other thing that we have to remember is that the populations are different. Europeans are much healthier. Because their populations, they're mostly white. Their diets are different. They eat healthier. So what might work for them, and the studies that are coming out of Europe, may not necessarily apply in the US, where the populations are much more diverse. Genetically, they're more diverse. And the people who are being affected, the Latin population, the Black population, are being disproportionately affected. They did dispel the it might work for 1 or 2 people here, but is 1 or 2 people sufficient to have it, to give it to everyone? You give it to 10 people, it works for 2, and doesn't work for 8.
Mm-hmm.
I even heard of a couple of months ago, I was listening to this YouTube video for this doctor, and he's a doctor who's pro-vaccine and everything, if I'm just going to say that right now, but he said they even found out there was a certain ingredient in cigarettes that could build a certain immunity. I don't know if you ever heard of that. That could build a certain. He said, I don't want to be promoting that and telling everybody to go smoke cigarettes out there.
Well, smoking is
really
a comorbidity. Smoking is a comorbidity for the disease. Like, if
exactly,
you're more likely to die from it. So
that I couldn't understand. But if I could find the video again, I'll more try to forward it to Emma, and she'll probably forward it to you. You know.
There are lots of things. I mean, there might be a plant somewhere out there that could cure us completely, but we just haven't found it, and we don't know where. We found it.
Yeah, in buns. They have a cure in buns.
Vernette has spoken about that. There could be something out there you can never tell, you know. But
for every disease, there could be plants.
Lemongrass. Didn't they say lemongrass was growing?
We don't know. I mean, my aunt was telling me that I think some papaya leaf tea or something was helping people who had chikungunya. It was dengue fever. It was helping reduce the severity of the symptoms and so on.
Yeah,
and it's entirely possible. It's just that the research hasn't been done So the scientific community can't promote it as a cure. And then if it doesn't work for one person, then that like throws the whole thing out. Right. They throw the baby out with the bathwater when one person has a contraindication.
But it's interesting what he said when he said they only apply their research to one aspect and not to the natural that much, you know what I mean?
I mean, we can try. There are people who work on natural remedies. It's just that they're a much smaller fraction of
the clients. First, not what we think we do. It's not all about us. And I hate that.
Vernette, you want to give the outro?
Yeah, so everybody asked all questions they asked already.
Anything else?
Any more questions? Okay.
I have some private bakes to send to people there, so they have to tell me which address to send it to. Eh?
Okay, you do that after.
Okay, no problem.
You will get that. Where? Okay. Dr. Simon and Dr. Fontenard, wow, it was a pleasure having you all in our midst. We got a lot of valuable information. I'm hoping that some of us are able to pass it down to family and friends. Thank you so much.
Yeah.
Thank you, and congratulations to the two of you all on your achievements.
Thank you.
Thank you. It was I really enjoyed the dialogue. And hopefully we can make because I mean I'm concerned. My family's in St-Lucia, my friends are in St-Lucia. I don't want them to get affected.
Yeah.
Right.
I think we take it too lightly. I don't think we realized how impactful.
They do take it too lightly.
Yeah.
Yes, we should do it again with more.
Oh yeah, sure. Dr. Simon, we may have to. We may want to have something with you along your lines of
education.
Try to get a few educators on board and get their perspective, because I feel our next topic that we have, we want to have a topic on virtual learning. And try and see if we can, find a way where the teachers help the students help the teachers. Our group, we have lots of teachers there. We're trying to get them on board, but but we're working on that. We're working on that. Because I know that
coming for you next.
They've been neglected, and not for their own fault, but so we're trying to work on that.
Yeah, just let me know in advance.
Yeah, man, we're gonna set it up
no problem
for everybody. Once again, thank you very much. I appreciate it, and I'm extremely proud of you both. I'm proud of.
I'm so excited about that.
Man, trust me, very successful.
So
thank you to my friends from Montreal for joining us. Taki Roberts and her husband.
Thank you for inviting us.
Yeah, man, my cousin Christopher Collymore he's in there, he's listening. The Collymore family big, we are everywhere, man. And we have our own radio show, our own radio station. We got it.
There you go.
Trust me, we've done 2 radio shows already, and
we're trying.
Yeah,
we could invite y'all into something. We'll plan something with your group.
Class of 85. So we are in a WhatsApp group, but we haven't been on Zoom lectures before. So I just want to say thanks to my sister for extending this invitation. It was a pleasure to see Suean. I haven't seen her in many, many years, and we are not in touch. I'm very proud of you, Suean, and it was a really honor to listen to your to elucidate on the topic of coronavirus.
And Emma, my niece, I want to say thank you very much for making this happen. You had a lot to do with that thing, man. So thank you very, very much for doing that. And we'll be connecting some more to have more sessions like this, man. There we go. It's freezing,
Mom. Huh?
Not freezing,
All right.
I know. I'm going to fix that later on.
Okay.
Bye.
Yes.
All right. Enjoy the rest of your day, guys. Bye-bye.
Anybody want to see afterwards? The after party is on afterwards.
What
is? After party is on.
Okay.
Okay, Tafari.
Yes.
Okay, I was asking you a question.
Oh, sorry.